Hello, everyone. Today we'll be focusing on 75 NCLEX questions that are commonly tested and helping you prioritize key topics for your study sessions. And this will help you boost your confidence and also improve your chances of passing the NCLEX on your first attempt. Let's get started. Our first item states, a nurse is monitoring a patient who is currently prescribed digoxin. Which of the following lab values should the nurse prioritize assessing? This question has been asked 5 times. Option A, magnesium, B, potassium, C, chloride, D, bicarbonate. The correct answer here is letter B, that's potassium. It's very crucial for us to monitor this electrolytes, especially for those patients taking digoxin, because hypokalemia can predispose them to developing digoxin toxicity. We know that we also need to monitor other electrolytes for good practice, but that potassium has a unique and a most critical impact on the safety and also effectiveness in digoxin therapy. We know that digoxin is a cardiac glycoside. It's primarily used to manage atrial fibrillation, also heart failure. And the use of this medication has become more selective due to the potential interactions and also the risk of toxicity. And so before you're going to administer this medication, you should confirm that the patient's apical pulse is within acceptable ranges, at least 60 beats per minute in the adults, 70 beats per minute in children, and 90 to 110 beats per minute in infants. Now, for the therapeutic range for the digoxin, it typically falls between 0.5 and 2 nanograms per ml. And we need to make sure that we are monitoring the potassium levels to ensure the medication safety and efficacy. Let's have number 2. A mental health nurse is caring for a patient diagnosed with bipolar disorder who has recently settled down after displaying disruptive behavior. Which approach would be the most effective in helping to reduce the chances of a similar incident occurring? This question has been asked 3 times. A, discuss the potential outcomes of such behaviors with a patient. B, support the patient in identifying specific triggers or emotions that may have contributed to the outbursts. C, prioritize maintaining the patient's safety at all times. And D, present the patient with various strategies to manage similar behaviors in the future. Your answer should be letter B, because when you're helping the patient recognize the triggers or emotions that could have led to the outburst, it's very important in minimizing future disruptive episodes. If you selected letter A, this is incorrect because discussing behavior outcomes is suitable before the situation escalates, not after the patient has calmed down. Letter C is also incorrect because ensuring safety is crucial during an episode, but it's less relevant once the patient is calm. D is also incorrect because patients in crisis may not really fully grasp behavioral strategies, and these are best introduced when the patient is calm and open to learning. Number 3. A nurse is caring for an adult client with a nasogastric tube connected to intermittent suction. Which electrolyte imbalances should the nurse monitor for in this client? The question has been asked 4 times in the past. Option A, hyponatremia. B, metabolic acidosis. C, hyperkalemia. And D, hypercalcemia. The correct answer here is letter A. An NG tube, when it's connected to suction, can cause so many electrolyte imbalances, notably hyponatremia and the other one, hypokalemia. We know that stomach fluids contain sodium, and when suction removes them, the client will lose enough sodium and they are going to become hyponatremic this time. Letters B, C, and D are incorrect. Letter B, because metabolic alkalosis, not acidosis, is often seen with an NG tube to suction. So by removing hydrochloric acid from the stomach, suction increases bicarbonate levels in the body, pushing towards alkalosis. C is incorrect. Hypokalemia or low potassium rather than hyperkalemia is a frequent result of nasogastric tube suction, as the potassium and the sodium are lost through this process. Now, letter D, it's also incorrect because hypercalcemia is not typically related to nasogastric tube suction. It is more likely linked to conditions like hyperparathyroidism or the use of certain medications such as the thiazide diuretics. Number 4, a patient diagnosed with rheumatoid arthritis has been prescribed prednisone to help manage inflammation and rheumatoid symptoms. At what time should the healthcare provider advise the patient to take this medication? This has been asked 8 times. A, early in the morning. B, around midday. C, in the evening before sleeping. And D, anytime as long as it's taken consistently each day. The correct answer here is letter A. For conditions like RA, corticosteroids such as the prednisone are best taken early in the morning, preferably before 9 in the morning. And so the timing will help match the body's natural rhythm of the glucocorticoid release from the adrenal glands, which is highest in the morning. Additionally, the prednisone can be stimulating, and this can also lead to sleep disturbances if taken later in the day. Now, the other options, letters B, C, and D, are incorrect because we know that prednisone should be taken at the same time each day, but generally it's recommended to take it in the morning to minimize the potential side effects like insomnia. And we know that this medication is something that is indicated so many inflammatory conditions like RA, asthma, lupus, also multiple sclerosis exacerbation. And so this patient or these patients that will be taking corticosteroids, such as prednisone, should take the drug with food to prevent stomach irritation, and they need to comply to the regimen with the prescribed dose. And this is going to require them to not abruptly taking the medication because this can lead to addisonium crisis. Now, when a patient is also taking the corticosteroid, they need to be cautioned against the use of the non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen, because these medications can increase their risk of developing stomach ulcers. Number 5, the healthcare provider prescribes safdanir at a dose of 30 milligrams per kilogram per day for a child weighing 10 kilograms. The medication is to be given every 6 hours in 4 divided doses. How many milligrams of safdanir should be administered per dose? Options: A, 25 milligrams, B, 50 milligrams, C, 75 milligrams, and D, 100 milligrams. The correct answer here is letter C, 75 milligrams. Let's talk about how it's calculated. Well, the medical provider ordered the dose of safdanir at 30 milligrams per kilogram per day. And it's given that a child weighed 10 kilograms. So we are going to multiply the prescribed dose by the child's weight to find the total daily dose. So that's going to be 300 milligrams per day. Next is we're going to identify here the frequency, and supposedly it's to be given every 6 hours. So we are going to divide the total daily dose into 4 equal parts to cover the 24-hour period. So you're going to divide 300 milligrams by 4 doses. So this will result into 75 milligrams per dose. So this is something that you will administer every 6 hours. Let's have number 6. The nurse is evaluating a client with symptoms potentially indicative of Raynaud's phenomenon. Which of the following observations would be most consistent with a diagnosis of Raynaud's phenomenon? This question has been asked 9 times. The options are A, swelling localized to one arm or leg. B, intense vasospasms causing discomfort in the fingers or toes. C, popping or grinding sounds in the joints. And D, cramping or aching in the lower legs when walking. The correct answer is letter B, because we know that Raynaud's phenomenon involves painful vasospasms in the fingers or the toes, and this is often triggered by cold temperatures or emotional stress. And this is also a condition that is closely associated with autoimmune disease like SLE and scleroderma. Now, if you selected letter A, this is incorrect because swelling isolated to one limb is commonly associated with DVT, and it's not a characteristic of Raynaud's phenomenon. For letter C, this is also incorrect because joint crepitus is generally observed in cases of osteoarthritis, and it's not related to Raynaud's. And letter D is incorrect as well because claudication or pain in the legs during walking that improves with rest is typically linked to the peripheral arterial disease and not Raynaud's phenomenon. Number 7. A nurse is documenting the obstetric history of a client who has come for prenatal care. The client states she has a 5-year-old child born at 39 weeks and reports the one miscarriage at 8 weeks, which occurred 3 months ago. For her current pregnancy, what is the total or what is the correct GTPAL documentation? This question has been asked 7 times. Option A, G2, T1, P0, A1, L1. B, G3, T1, P0, A2, L1. And C, G2, T1, P1, A0, L1. And D, G3, T2, P0, A1, and L1. The correct answer is letter A because the client's gravida is 2, indicating 2 pregnancies, one that was prior and the current one as well. And her full-term delivery is recorded as 1 since her child was born at 39 weeks. And she has no history of preterm delivery, so that's going to be 0. She has had 1 miscarriage documented as an abortion, so that's going to be A1. And her living child count is 1. And if you selected letter B, this is incorrect because this option incorrectly adds another pregnancy and abortion that was not reported by the client. And letter C, this choice is also incorrect because it lists a preterm birth, which the client has not experienced. And letter D is also incorrect because this inaccurately suggests 2 term births and misreports the gravity count. Let's have number 8. A nurse is assigned to care for a patient who just underwent a small circular punch biopsy to assess for potential skin cancer. Which of the following should the nurse monitor most closely at the biopsy site? And this question has been asked 6 times. A, wound separation. B, infection signs. C, bleeding. And D, inflammation. The correct is letter C. Following a punch biopsy will typically involve, actually this is a procedure that will involve a circular tool measuring about 1 millimeter to 10 millimeters in diameter. And the primary concern is monitoring for bleeding at the site. Now, if you selected letter A, this is incorrect. Wound separation is what we call as dehiscence, and this is the splitting open of wound edges and will happen a day or actually days after surgery, especially in the abdominal area. And for letter B, infection signs, although we know that the patient may have a potential risk to developing infection anytime, the skin barrier has been compromised, but it is not immediate priority in this case because the biopsy was performed in a sterile setting and signs of infection would not typically present this soon after the procedure. Now, letter D is also incorrect because some swelling is also natural response after skin disruption, like a biopsy, and it's not generally a cause for immediate concern. Number 9. A healthcare provider is preparing to administer a newly prescribed dose of zolpidem to a patient. For which of the following conditions is this medication most commonly prescribed? This question has been asked 6 times. A, attention deficit disorder. B, anxiety disorders. C, sudden onset sleep episodes. And D, difficulty falling asleep. The correct answer here is letter D. We know that this is a medication that is a hypnotic, and this is specifically used to manage the insomnia. And if you selected letters A, B, and C, these are all incorrect. We know that ADHD this person will manifest short attention span. They're going to have impulsiveness, hyperactivity, but the person here will be treated with medications that can help enhance their focus, not zolpidem. Now, for anxiety disorders in B, including the generalized anxiety disorder, this will typically require medications such as the SSRIs to alleviate excessive worrying. And for letter D, this is narcolepsy, wherein the person will have sudden episodes of daytime sleepiness, in which they're going to require that modafinil, and that's going to be more appropriate for that kind of condition. Number 10. The man has sickle cell disease and his partner is a carrier. What is the likelihood their child will inherit sickle cell disease? A, 25%, B, 50%, C, 75%, and D, 100%. The correct answer here is letter B. That is 50%. We know that sickle cell disease is inherited in an autosomal recessive manner, means that a child will need 2 copies of the sickle cell gene, SS, to have the disease. So here, the S represents a normal gene and S represents the sickle cell gene. And so with a father with a sickle cell disease can only pass on the S gene, and the mother as a carrier has a 50% chance of passing the S gene and a 50% chance of passing the normal S gene. And so the child here will have 50% chance of having the sickle cell disease. Number 11. A nurse is monitoring a patient who is being treated with a prescribed hydralazine. Which of the following observations would most likely reflect an effective therapeutic response to the medications? Now, this has been asked 9 times. A, blood pressure of 118 over 75 mmHg. B, heart rate of 66 beats per minute. And C, LDL cholesterol level of 170 milligrams per DL. And D, INR of 1.1. The correct answer is letter A. Hydralazine works as a vasodilator, and this is the medication that is intended for hypertension management. And so when you're seeing a blood pressure of 118 over 75, it suggests that there's effective reduction in the blood pressure. And for letters B, C, and D, these are incorrect. Although the heart rate and the LDL cholesterol levels are within healthy ranges, these parameters are not directly influenced by hydralazine treatment. Now, when you're looking into item D, or letter D, INR of 1.1, we know that INR is associated with blood clotting, and this is something that we need to monitor for patients who are taking anticoagulants like warfarin, not hydralazine. Number 12. During an examination of a patient's nasal structure, what observations would indicate a standard healthy assessment? This question has been asked 10 times. A, nose is aligned centrally and appears symmetrical. B, nose is aligned centrally but displays greenish discharge. And C, nose is slightly off center with no signs of discharge. And D, nose is irregular in shape and proportionate to other facial features. The answer is letter A, because this one reflects normal assessment findings where the nose is centrally aligned, symmetrical, free from any discharge, and also proportionate to the other facial features. Now, letter B is incorrect because a greenish discharge is typically abnormal. Now, for letters C and D, these are also incorrect. A healthy nose should appear symmetrical, not irregular, and also not off center. Number 13, a provider orders an infusion of a medication at 4 micrograms per kilo per minute for a patient weighing 75 kilograms. The pharmacist supplies the medication as 600 milligrams mixed in 400 mLs of D5 water. At what rate in mLs per hour should the nurse set the infusion? This has been asked 5 times in the past. Options are A, 10 mLs per hour, B, 12 mLs per hour, C, 14 mLs per hour, and D, 16 mLs per hour. The correct answer is letter B, that is 12 mLs per hour. How do we get to this number? Now, what we're going to do here first is to determine the patient's required dose in micrograms per minute. We know that the ordered dose is 4 micrograms per kilogram per minute, and the patient weighs 75 kilograms. So we're going to multiply that 4 micrograms per kilo per minute by the patient's weight of 75 kilograms. So that's going to result into 300 micrograms per minute. Now, the next step is to convert the micrograms per minute to milligrams per minute. So we know that 1 milligram is equal to 1,000 micrograms. So we're going to convert 300 micrograms to milligrams, which is basically 0.3 milligrams per minute. And step 3, we're going to have to find the concentration of the medication in milligrams per ml. Now, as I have said earlier, the pharmacy provided 600 milligrams of the medication in 400 mLs of D5 water. Okay, so that is going to be 600 milligrams. You're going to divide that by 400 mLs, so resulting into 1.5 milligrams per ml. Now, step 4 is to calculate the infusion rate in mLs per minute. So what you're going to do here is to divide the required dose by the concentration to get the rate in mLs per minute. So that is basically 0.3 milligrams per minute. Divide that by 1.5 milligrams per ml. So this will result into 0.2 mLs per minute. Now step 5, which is the last step, is to convert mLs per minute to mLs per hour. So what you're going to do here is to convert the infusion rate to mLs per hour by multiplying by 60. So this is going to result into 12 mLs per hour. Let's have number 14. A nurse is assessing a widower who expresses feelings of extreme anxiety and a sense of impending doom. Which of the following responses by the nurse best demonstrates therapeutic communication? This question has been asked 3 times in the past. Options are A, it's best if you try not to think about it. Focus on feeling safe here. And B, has there been a recent event or is there something from the past that might be causing these feelings? Letter C, the anxiety will improve once your medication takes effect. And letter D, take some deep breaths and you'll start feeling better. The answer here should be letter B, because this statement encourages the patient to explore potential underlying causes of their distress, and this can foster open communication. And this also promotes a much more therapeutic dialogue that will respect the client's feelings and also provides an opportunity to discuss any contributing factors. Now, if you selected letter A, this is a response that does not encourage the client to express their feelings, because if you're telling someone to try not to think about it, can actually minimize the client's experience, and it also discourages open communication. And it may also inadvertently suggest that the client's feelings are not important, which can also hinder the trust and also rapport. Now, if you select the letter C, this statement relies on medication rather than exploring the client's immediate emotional experience. We know that medication may help with anxiety, but it does not address the client's current need to talk about their feelings. We know that therapeutic communication is focusing on being present with a client, also validating their emotions, and also helping them process any immediate concerns. Now, letter D is also incorrect. We know that deep breathing can help manage anxiety symptoms, but this response primarily offers a technique rather than encouraging the patient to share their thoughts and emotions. We know that, again, therapeutic communication involves actively listening to the client's concerns. And with this nurse simply suggesting breathing techniques may make the client feel that their emotional experience is not fully understood. Now we'll have number 15. A nurse is providing guidance to parents who are concerned about their child's frequent episodes of bedwetting at night. Which of the following strategies would the nurse most likely suggest for the parents to support their child in managing this issue? This has been asked 3 times. A, start a record of the child's bathroom patterns. B, implement consequences after each bedwetting incident. C, use nighttime protective garments such as pull-ups regularly. And D, encourage the child to drink fluids close to bedtime. Your answer here should be letter A, because keeping a record of the client's or the child's voiding habits is going to be useful for you to identify the patterns and also the potential triggers for bedwetting. And this will also allow us to tailor the interventions. Now, if you selected letter B, it's also incorrect because punishing the child for bedwetting may harm their emotional well-being, and it's unlikely to reduce future episodes. There should be support and understanding to make, uh, because these are known to be effective approaches. Now, if you selected letter C, this is also incorrect because routinely using pull-ups or, let's say, similar products can discourage a child from waking up to use the toilet. Instead, exploring proactive strategies is going to be more beneficial. Now, if you selected letter D, this is also incorrect. If you're encouraging fluid intake at night before bed can increase their likelihood of bedwetting. And so you need to encourage the child to empty their bladder before bedtime. That is going to be much more supportive. Let's have number 16. A nurse is educating a patient on the purpose of albumin infusion therapy, which is prescribed to address low albumin levels. The nurse emphasizes that albumin functions primarily through which of the following mechanisms? This has been asked 3 times. A, encouraging the production of red blood cells within bone marrow. B, boosting the formation of clotting proteins in the liver. And C, strengthening the blood vessels' osmotic pool to retain fluids. And D, reducing the body's release of immune-related signaling molecules. The answer is letter C. When you're administering the albumin, it will raise the concentration of this protein in the bloodstream. And this can also increase the osmotic, or what we call as colloidal pressure. And so this pressure will actually maintain the fluid within the blood vessels. It will cause limiting the fluid loss into the surrounding tissues and also supporting blood volume stability, especially for those patients with low albumin levels to prevent or reduce edema. Now, letter A is incorrect because albumin does not stimulate red blood cell production. We know that erythropoietin is the primary factor in the red blood cell synthesis, not albumin. Letter B is also incorrect. Although we know that albumin is made in the liver, it does not contribute to clotting factor synthesis. When you're seeing letter D, this is also incorrect. The main role of the albumin relates to fluid balance, not to directly modulate cytokine release. Let's have number 17. The nurse is administering anticoagulation therapy with enoxaparin to a patient. Which of the following items in the patient's recent medical history should be brought to the attention of the primary healthcare provider? This question has been asked 7 times. A, recent lumbar puncture, B, hypertension, C, chronic knee pain, and D, history of DVT. The correct answer is letter A, because a recent lumbar puncture or any kind of procedure involving spinal intervention requires careful follow-up when enoxaparin is prescribed. We know that this medication can increase the risk of bleeding. And in the case of a spinal procedure, there is a potential for a hematoma to form at the site, which could compress nearby nerves, and this will lead to significant neurological issues. So if you selected letters B, C, and D, these are all incorrect. Hypertension, chronic knee pain, and history of DVT do not contraindicate the use of enoxaparin. In fact, enoxaparin is going to be used to prevent the thrombotic events. Let's have number 18. The nurse is preparing to administer a dose of amiodarone. Which of the following lab values should the nurse prioritize for monitoring during amiodarone therapy? And this question has been asked 9 times. A, platelet count, B, blood glucose levels, C, uric acid levels, and D, thyroid stimulating hormone levels. The correct answer here is letter D, because monitoring the TSH levels is very important when a patient is taking amiodarone, because it can disrupt the thyroid function. This can potentially lead to either hyperthyroidism or hypothyroidism, because the amiodarone is going to interfere with the conversion of T4 to T3. Often will cause an increased serum T4 and reverse T3 and decreased serum T3 levels. So we know that TSH is a critical marker of thyroid function, and so this is something that you should closely monitor. If you selected letter A, platelet count does not require monitoring with amiodarone. Monitoring the platelet count is more associated for patients on medications, let's say heparin, which can impact the platelet levels. Letter B is also incorrect, because the blood glucose levels are not routinely monitored with amiodarone therapy, although they are important for patients on insulin or managing diabetes. And if you're seeing letter C, this is also incorrect, because uric acid monitoring is not necessary for amiodarone use. And this is something that you should monitor for patients who have history of gout or, let's say, kidney concerns. Number 19, a nurse is performing an initial health assessment for a woman in her early pregnancy. Recognizing the importance of a thorough history, the nurse specifically inquires about any previous occurrences of rheumatic fever. The nurse understands that gathering this information is primarily aimed at A, assessing potential cardiovascular complications related to rheumatic valve disease under increased hemodynamic load, B, implementing precautions to prevent potential and congenital infection in the fetus, and C, planning for prophylactic antimicrobial therapy during labor and postpartum to prevent complications, and D, evaluating pulmonary function to detect any signs of recurrence linked to rheumatic sequelae. The answer here should be letter A. Rheumatic fever can lead to lasting damage to the heart valves, and pregnancy may impose additional strain, which can potentially exacerbate these valvular issues. If you selected letter B, this is already incorrect because rheumatic fever is not a congenital or not a transmissible condition in the prenatal or perinatal period. Letter C is also incorrect because there is no indication for routine prophylactic antibiotics in this scenario. And letter D is also wrong because rheumatic fever does not typically affect pulmonary function directly, making lung auscultation for recurrence irrelevant. Let's have number 20. Which client statement indicates a misunderstanding of instructions and requires clarification by the nurse? This question has been asked 3 times. A, I shouldn't have anything to eat or drink for 8 hours before this test. B, a belt will be placed around my belly to monitor my baby. C, if the test results show my baby's heart rate reacts, it's a good sign. And letter D, an abnormal test result might mean I'll need more tests done. The answer here should be letter A, because this statement reflects misunderstanding, because we know that the non-stress test does not require fasting. So the client should be advised to eat and drink as usual unless instructed otherwise by the healthcare provider. Now, if you selected letter B, this is incorrect because the non-stress test involves placement of a monitor around the abdomen to track the fetal heart rate and also the movement, which is accurate. Now, letter C is also incorrect because in the non-stress test, a reactive result, which means where the fetal heart rate rises appropriately with fetal movement, is actually a positive sign indicating fetal well-being. Now, if you selected letter D, this is also incorrect because if the stress test result is non-reactive or concerning, there's going to be further evaluation that will be necessary to ensure fetal health and to also demonstrate an understanding of the possible need for additional testing. So again, this statement is actually looking for that negative answer requiring clarification by the nurse, which is letter A. Let's have a number 21. A nurse is educating a client on the functionality of their recently prescribed insulin pump and the type of insulin it administers. The nurse recognizes which category of insulin is most commonly utilized in insulin pumps to manage post-meal blood glucose spikes. This question has been asked 9 times in the past. A, rapid-acting insulin. B, ultra-long-acting insulin. C, intermediate-acting insulin. And D, long-acting insulin. The correct answer is letter A, because rapid-acting insulin is frequently chosen for use in insulin pumps because of its rapid onset and its effectiveness in managing postprandial blood glucose. And so this is a type of insulin that can actually mimic the body's natural response by being administered 5 to 10 minutes before or during meals. And it will help in preventing spikes in blood sugar after eating. And so we know that short-acting insulin, such as regular insulin, may sometimes be substituted for in pumps as well as for a similar purpose. But most often it's going to be the short or the rapid-acting insulin. Now, if you selected letter B, this is incorrect because ultra long duration insulin, such as like the Digludec, are not suitable for insulin pumps because they are designed for basal or what we call as all-day control rather than post-meal glucose adjustments. If you selected letter C, this is also incorrect because this will provide extended glucose management over 10 to 24 hours. primarily will serve as background insulin, which does not really align with the pump's purpose for rapid correction. Now, if you selected letter D, this is also incorrect because long-acting insulins like glargine or detamir, they function for basal glucose control over extended time and are not compatible with the pumps that are intended for immediate corrective insulin delivery. Let's have number 22. A nurse is monitoring a patient who is 6 hours post-op after transtibial amputation. Which of the following observations necessitates immediate intervention? And this question has been asked 5 times. A, anxiety and agitation. B, systolic blood pressure of 140 mmHg. C, heart rate of 90 beats per minute. And D, mildly diminished bowel activity across quadrants. The correct answer here is letter A. The presence of the anxiety or agitation in a post-op patient, particularly after a major vascular surgery like a transtibial amputation, can be an early sign of a complication such as hemorrhage, or it could be hypovolemic shock, or it could be pulmonary embolism. So these conditions will require urgent assessment and also management to prevent them from worsening. If you selected letter B, systolic blood pressure of 140 mmHg, may be an anticipated response to post-op stress, and it does not really indicate a pressing concern. However, when you are seeing hypotension, that would be more indicative of shock or blood loss and would warrant a much more immediate attention. Now, if you selected letter C, heart rate of 90 beats per minute, this is incorrect because a heart rate of 90 beats per minute remains within the normal range and does not typically signal a complication. Now for letter D, this is also incorrect because reduced bowel sounds are common in the immediate postoperative phase because of the anesthesia effects. And this is not going to be a red flag in this scenario. Let's have number 23. A nurse is caring for a patient with a chest tube following a diagnosis of pneumothorax. While assessing the area around the chest tube insertion site, the nurse notices a popping sensation under the fingertips. What action should the nurse take? This question has been asked 7 times in the past. For letter A, record the finding as a routine observation. B, momentarily clamp the chest tube. C, inform the healthcare provider immediately. And D, administer supplemental oxygen via nasal cannula. The correct answer is letter C. You should inform the healthcare provider as early as possible because this indicates subcutaneous emphysema wherein the air becomes trapped under the skin layers, also known as the crepitus. And so this actually suggests a potential complication, and this requires the medical provider's attention to evaluate further interventions. Maybe the patient will require adjustment of the chest tube suction. Now let's have the other items, or letters A, B, and D. These are incorrect. For A, when you're recording the finding as routine, this is inappropriate because subcutaneous emphysema is a complication of chest tube therapy. It requires medical attention. B is also incorrect because chest tubes should not be clamped routinely because this is going to cause tension pneumothorax as well. Now, letter D is also incorrect because it does not necessitate oxygen supplementation. Rather, it involves managing the chest tube settings, potentially increasing the suction to resolve the issue. Let's have number 24. A patient who has been prescribed phenozipyridine for urinary discomfort is being prepared for discharge. Which important information should the nurse emphasize? This question has been asked 7 times in the past. A, the medication may cause an increase in urinary frequency. B, expect your urine to change to reddish orange hue. C, the medication will likely cause urine to develop a strong odor. And D, the appearance of dark, concentrated urine is anticipated. The correct answer here is letter B, because we know that the phenazopyridine can result in harmless reddish orange discoloration of the urine, and this is a known side effect. Once the medication is discontinued, the color of the urine will return to its usual consistency and the color. Now, if you selected letters A, C, and D, these are incorrect because we know that phenazopyridine does not increase urinary frequency, or it will not alter the urine's odor, or it will not lead to highly concentrated urine. The medication is something that is commonly prescribed to alleviate symptoms such as pain, burning upon urination, urgency, and also discomfort in the lower urinary tract, which can result from infection, could be injury, surgical, and also endoscopic exams or catheter use. Now, this medication provides only symptomatic relief and does not address the underlying cause of the discomfort. Now, patients should discontinue the phenazopyridine once their symptoms subside. Let's have number 25. A pregnant woman or patient is admitted for severe persistent nausea and vomiting, unresponsive to initial treatments. The healthcare provider prescribes granisetron to manage her symptoms. Which adverse effect should the nurse prioritize monitoring in this patient? This question has been asked 4 times in the past. A, recurrent vomiting episodes. B, irregular heart rhythm. C, hypoventilation. And D, mild abdominal discomfort. The correct answer here is letter B. Because we know that granisetron, a 5-HT3 receptor antagonist, is used to alleviate severe nausea and vomiting. Also, it carries a risk of QT interval prolongation, which can lead to life-threatening arrhythmias. Now, if you selected letter A, this is incorrect because recurrent vomiting is not a known adverse effect of granisetron, though monitoring symptom resolution is important. If you selected letter C, this is incorrect because respiratory depression is not typically associated with granisetron. And letter D is also incorrect. Mild discomfort may occur, but it's not a significant concern compared to the risk of cardiac arrhythmia. Let's have number 26. A nurse is advising a client with chronic kidney disease who is undergoing hemodialysis on dietary choices to manage nutrient intake effectively. Which meal choice by the client indicates they have understood the dietary guidelines? This question has been asked 3 times in the past. A, apples, oatmeal, black tea. B, ham, papaya, milk. C, salted fish, baked beans, tomato juice. And letter D, smoked turkey, pancakes, cantaloupe. The correct answer is letter A. For clients that have chronic kidney disease undergoing hemodialysis, they should focus on foods that are low in sodium, low in potassium, low in phosphorus, and also low in protein, because excessive intake of these can actually strain the renal function. So the combination of apples, oatmeal, and black tea is lower in potassium and phosphorus, and it's more suitable for a renal diet. Option B is incorrect because ham is actually high in sodium and also phosphorus, while papaya and milk are also high in potassium, all of which are typically restricted in clients with a compromised kidney function. And for letter C, salted fish is high in sodium. Baked beans have considerable protein and phosphorus, and also tomato juice is high in potassium. so making this option unsuitable for a patient with CKD. Now, letter D is also incorrect because smoked turkey contains high sodium levels, while the cantaloupe has a high potassium content, which can really exacerbate the issues in clients with a CKD. Let's have number 27. A client with advanced chronic respiratory illness is newly prescribed home oxygen therapy. Which guidance should the nurse emphasize in the client's education plan to ensure safe and effective oxygen use at home? This question has been asked 3 times. A, tuck the oxygen tubing securely under the bedding to prevent it from tangling. B, apply only oil-based products on the lips and nose to prevent dryness. D, or letter C, strictly avoid any open flames or smoking while oxygen is in use. In D, set the oxygen flow to the highest level for enhanced breathing support. The correct answer here is letter C, because we know that smoking or using open flames in the presence of oxygen can significantly increase the risk of combustion, and it should be avoided. So the client and also their families must be informed about these critical safety precautions. If you selected letter A, this is incorrect because positioning oxygen tubing beneath the bedding can hinder the airflow. It will elevate the risk of overheating, also fire. So it is safer to keep the tubing in open, ventilated areas. If you selected letter B, this is also incorrect because petroleum or oil-based products are highly flammable, especially around oxygen, so it can pose a potential fire hazard. So what we're going to do here instead is to advise only water-based lubricants when they're using nasal cannula O2. And this is to prevent the dryness in their nostril. If you selected letter D, this is also incorrect. Elevating the oxygen flow rate beyond the prescribed level is unnecessary, and this can also complicate into oxygen toxicity. And so the client should be advised to maintain the flow rate as directed by the healthcare provider. Number 28. A nurse is preparing to attach a client with advanced renal disease to a continuous cardiac monitoring. What is the primary rationale for this intervention? This question has been asked 3 times. A, clients with advanced renal disease commonly experience persistent elevated blood pressure. B, elevated serum potassium levels could lead to serious cardiac rhythm disturbances. And C, cardiac monitoring is essential to gauge the patient's readiness for renal replacement therapy. And D, clients with renal disease frequently display inaccurate cardiac signals like asystole. Your answer this time should be letter B. People with advanced renal disease are at a higher risk of retaining potassium, which can elevate the serum levels, can lead to hyperkalemia. And we know that this can disrupt the heart's electrical conduction. It can lead to dangerous arrhythmias. Now, we need to make sure that we are monitoring the patient's heart rhythm continuously to detect these life-threatening abnormalities. Now, if you selected letter A, this is incorrect. Although high blood pressure is often observed in renal disease, it is typically monitored with a blood pressure device rather than a cardiac monitor. Letter C is also incorrect. We know that cardiac monitoring may highlight arrhythmias linked to electrolyte imbalances, but it's not primarily used to determine the need for renal replacement therapies like dialysis, which is generally decided based on the lab values, patient symptoms, and also comprehensive assessment. Now, if you selected letter D, this is also incorrect because false readings such as asystole are not a characteristic concern in renal disease. The primary focus of monitoring is to detect real arrhythmias due to electrolyte imbalances, particularly hyperkalemia. Let's have number 29. The nurse is assessing the psychological development or psychosocial development of a 2-month-old infant based on Erickson's stages of psychosocial development. Which of the following stages is most accurately associated with this age group? This question has been asked 7 times in the past. A, initiative versus guilt. B, autonomy versus shame and doubt. C, trust versus mistrust. And D, industry versus inferiority. The correct answer is letter C. Trust versus mistrust is the foundational psychosocial stage that spans from birth to approximately 18 months. And we know that during this period, the infants can rely or they rely on consistent and nurturing caregiving to develop a fundamental sense of trust. So when caregivers respond reliably to the infant's needs, a secure attachment forms. It can foster trust. Now, inconsistent or let's say neglectful care can also hinder trust, and this will lead to mistrust as a default response to the world. Now, if you selected letters A, B, and D, these are incorrect. For A, initiative versus guilt is associated to preschool age children, typically between ages of 3 to 5. And in this stage, children explore their environment and assert control, developing initiative through successful interaction. And so if they fail to meet this milestone, this can result in a feeling of guilt if they are discouraged from acting on their impulses. Now, if you selected letter B, this is also incorrect because autonomy versus shame and doubt is relevant for toddlers aged 18 months to 3 years. And so here at this stage, children learn to exercise personal control, often through activities like toilet training. And if they're successful navigating the stage, this will help them feel autonomous. While if they will have repeated failures, or let's say if they get discouraged, this can result in shame and doubt. Now for option D, which is industry versus inferiority. This is applicable to school-age children, generally from ages 5 to 13. And around the stage, children encounter social and academic challenges, developing competence and a sense of industry when they succeed. So if they consistently face setbacks, feelings of inferiority may emerge. And so this stage is not applicable to the infants. Let's have number 30. A trauma nurse in the emergency department is assessing a patient who sustained blunt chest trauma from a high-impact blow. Which clinical sign would most likely indicate the presence of a pneumothorax? This question has been asked 10 times in the past. A, slowed respiratory rate. B, reduced or absent breath sounds on one side. C, rounded chest wall shape. D, audible whistling or air escape on the chest tube. The correct answer is letter B. Pneumothorax often presents with unilateral, diminished, or absent breath sounds as the air will accumulate in the pleural space, and this can also disrupt the normal lung expansion. Now, there's going to be some additional symptoms that may appear, such as dyspnea. There will be chest discomfort. There's going to be increased respiratory rate or tachypnea, and there's going to be signs of hypoxia as well, such as cyanosis. Now, if you selected letter A, this is incorrect because in cases of pneumothorax, the patient's respiratory rate usually increases. There's tachypnea. It does not decrease as the body is trying to compensate for the reduced oxygenation. Now, option C is also incorrect because a barrel-shaped chest is more indicative of COPD, such as emphysema, and it does not typically apply to acute pneumothorax. Now, letter D is also incorrect because a sucking or hissing sound suggests an open pneumothorax, usually from a penetrating injury Whereas the case scenario that we have involves a closed pneumothorax from the blunt trauma. Number 31. A patient diagnosed with a septic shock has the following assessment findings: generalized edema, cold and clammy skin, decreased urinary output, confusion, blood pressure 85/50 mmHg, and heart rate of 155. The nurse recognizes that these symptoms most likely indicate which stage of shock. This question has been asked 9 times in the past. A, compensatory stage, B, progressive stage, C, irreversible stage, and D, initial stage. The correct answer is letter B. The progressive stage of shock is characterized by the failure of the compensatory mechanisms, leading to signs like generalized edema, or what we call as anasarca. There's going to be confusion, a reduction in urine output, also oliguria, hypotension, there's going to be tachycardia. And so these findings indicate a decline in the organ perfusion and progression of shock. So if you selected letter A, this is incorrect because the compensatory stage is an earlier stage of shock when the body tries to maintain perfusion to the vital organs by increasing heart rate and inducing vasoconstriction. So the symptoms may include cold, clammy skin, but will lack the significant hypotension or multi-organ involvement. Now, if you selected letter C, this is also incorrect because the irreversible stage, or known as the refractory stage, is the final stage of shock. And this is going to be marked by severe hypotension, hypoxemia. There's going to be bradycardia, cyanosis, and often unresponsiveness as the perfusion to the critical organs is severely compromised. Now, if you selected letter D, this is also incorrect because the initial stage is typically asymptomatic or subtle. There's only minimal changes in the vital signs. It does not include the profound symptoms observed in the progressive stage. Number 32, the nurse is providing guidance to new parents of a 3-month-old on what to expect in the coming months. Which milestone should the nurse mention as likely to develop around the age of 6 months? This question has been asked 10 times in the past. A, rolling over both ways. B, walking independently. C, responding to simple one-step commands. And D, using a pincer grasp to pick up small objects. The correct answer is letter A. Rolling over both ways typically develops around 5 to 6 months of age. Now, letter B, which is walking independently, and letter D, which is with the use of that pincer grasp, occur much later, typically after 9 months. Now, the other option, which is letter C, responding to simple one-step commands, is usually developed closer to 9 to 12 months when the infants begin to understand the language. During an assessment of a 3-month-old infant, the nurse observes the infant's motor responses. Which finding would be concerning and warrant further evaluation? This question has been asked 5 times in the past. A, limited eye tracking of nearby objects. B, lack of vocalization such as cooing or gurgling sounds. C, limited reflexive grasp when an object is placed in their hand. And D, inability to push up with arms when lying on their stomach. The correct answer here is letter D. By 3 months, infants should start to demonstrate early motor skills such as pushing up on their arms when lying on their stomach. And so if there's limited ability to push up, it may indicate developmental delay. Now, if you selected letter A, which is limited eye tracking of nearby objects, vocalizations in letter B, and also reflexive grasp in letter C, these are skills that may vary slightly, but should be present or emerging by this age. Let's have number 34. When educating parents on the expected milestones for a 3-month-old, which action should the nurse describe as typical for this age group? This question has been asked 4 times. A. Grasp objects placed in their hand. B. Sit with minimal assistance. C. Wave goodbye when prompted. And letter D. Pull toys toward themselves. The answer is letter A. At 3 months, infants will begin to develop the ability to grasp objects when placed in their hands, often with a reflexive grasp. Now, for sitting in letter B with minimal assistance and waving goodbye when prompted with C and pulling toys towards themselves, these are developmental skills that occur at later stages. Let's have number 35. A patient with Meniere's disease is admitted to the hospital following a severe episode of vertigo and reports constant ringing in the ears known as tinnitus. The nurse knows that which of the following actions should be prioritized to ensure the patient's safety during hospitalization. This question has been asked 3 times before. A. Encouraging the patient to use hearing aids. B. Providing earplugs to reduce noise sensitivity. C. Assisting the patient with ambulation at all times. And D. Educating the patient on the importance of dietary sodium restrictions. The answer is letter C. Because Meniere's disease significantly increases the risk of falls due to sudden vertigo episodes, making it very essential for the nurse to assist the patient with ambulation to prevent injuries. If you selected letter A, this is incorrect because hearing aids may not address the vertigo or it might not improve the safety. They are not the priority intervention in this situation. If you selected letter B, this is also incorrect because while reducing noise sensitivity, it might help with tinnitus, but it will not address the risk of falls, which remains the highest priority. And for letter D, it's also incorrect. We know that sodium restrictions are beneficial in managing Meniere's disease long-term, but immediate safety measures to prevent the falls are more critical in the acute care setting. Let's have number 36. A nurse is educating high school students about the risks associated with a teenage pregnancy. Which statement indicates a key factor contributing to complications in adolescent pregnancies? This question has been asked 4 times before. A. Adolescent pregnancies generally experience the same risks as adult pregnancies. B. Delayed prenatal care due to denial or concealment can lead to complications. C. Adolescent growth patterns minimize pregnancy risks due to increased nutrition. And D. Teen pregnancies rarely result in low birth weight infants or preeclampsia. The answer here is letter B. Because many adolescent pregnancies are initially denied or concealed, which will often result in delayed prenatal care and also increases the risk of the complications such as prolonged labor, preeclampsia, low birth weight infants, and also proper prenatal care is crucial to mitigate these risks. Now, if you selected letter A, this is incorrect because adolescent pregnancies typically have a higher risk of complications compared to adult pregnancies, and adolescents are at increased risk for issues like preterm birth, low birth weight infants, preeclampsia, anemia, because of physical and emotional and sometimes socioeconomic factors that can impact prenatal care and also their nutrition. Now, letter C is also incorrect because adolescent growth patterns can actually increase pregnancy risks, and adolescents are still growing themselves, which can lead to competition for nutrients between the mother and the fetus. And this competition can also result in inadequate nutrition for both, which will contribute to poor fetal growth and complications such as low birth weight. Now, if you selected letter D, this is also incorrect because adolescent pregnancies have a higher likelihood of complications like low birth weight infants and preeclampsia. And so the combination of potential poor nutrition, lack of prenatal care, and immature physical development in adolescents can also lead to these complications. Let's have number 37. During a discussion on contraception with teenagers, which statement should the nurse emphasize to address a common misconception? This question has been asked 6 times in the past. A, teen pregnancies are typically planned by the adolescent. B, contraceptive use has decreased significantly among teens. And C, adolescent contraception use has improved, reducing pregnancy rates. And D, adolescent pregnancies occur primarily because teens are not capable of effective contraceptive use. The correct answer here is letter C. Because contraceptive use among teens has increased, which contributed to a decline in teen pregnancies, and teens will often use long-acting contraceptives, which will help reduce unplanned pregnancies. And also the misinformation about the contraceptive use should be addressed to ensure teens understand the benefits and options available. Now, the incorrect answers that we have are items A, B, and D. For A, this is incorrect because most teen pregnancies are unplanned. Teenagers are often not fully prepared for the responsibilities of parenthood, and factors like limited access to contraception, lack of education, and impulsive decision-making contribute to the unplanned nature of these pregnancies. Now, letter B is also incorrect because the contraceptive use among teenagers has actually increased over recent years, largely due to improved access to education and contraceptive options. And this has helped lower the rates of teen pregnancies as more teens are informed about and using contraception effectively. Now, if you select letter D, this is also incorrect because many teenagers are capable of using contraception effectively when they have access to accurate information, resources, and guidance, while some teens may struggle with consistency, improved education, and availability of long-acting contraceptives have helped reduce pregnancy rates. Number 38. The nurse is working with a teenage client who has recently been diagnosed with pregnancy, but is hesitant to tell her parents. Which nursing intervention is most appropriate to encourage a positive outcome for the client? This question has been asked 10 times in the past. A, advise the client to wait until the 3rd trimester to disclose the pregnancy. B, encourage open communication with family members to facilitate prenatal care. C, suggest that the client keep her pregnancy a secret to avoid family conflict. And D, focus on immediate birth planning and postpone any discussion on prenatal care. The correct answer to this item is letter B. Because early disclosure to family members can facilitate timely prenatal care, which is very important for managing the health of both the adolescent and also the fetus. And this patient will support and also the guidance from the healthcare providers, which will enable the teenager to overcome the fear of revealing their pregnancy and also ensure proper care. Now, letter A is incorrect because delaying the disclosure until the 3rd trimester can prevent the client from receiving timely prenatal care, which is important for the health of both the mother and the fetus. We know that early prenatal care can help monitor and address any potential health concerns. And also, this will provide the teenager the necessary support during the critical stages of fetal development. Now, if you select letter C, this is correct because advising the client to keep her pregnancy a secret can only increase stress, also increase isolation, and it will also delay essential prenatal care. And also with that, withholding the information can prevent the client from getting the emotional and practical support needed from her family, which can improve pregnancy outcomes. Now, letter D is also incorrect because focusing solely on birth planning without addressing a prenatal care actually disregards the importance of consistent medical monitoring and health education throughout the pregnancy. We know that the prenatal care is very critical for managing the client's physical and their emotional needs, and it can also help reduce the risk associated with adolescent pregnancies. Number 39. The nurse is explaining the importance of prenatal care to a teenager who just learned she is pregnant. Which statement by the nurse most effectively highlights the risk associated with delayed prenatal care in adolescents? This question has been asked 8 times. A. Adolescents typically do not need as much prenatal care as adults. B. Delaying prenatal care can increase the risk of low birth weight infants and other complications. C. Prenatal care should be sought only if you experience unusual symptoms. And D. Most adolescent pregnancies proceed without prenatal care. The answer is letter B, because delayed prenatal care can significantly increase the risk of complications such as the low birth weight infants, preterm delivery, and higher infant mortality rates. We know that early intervention through prenatal care is essential in reducing these risks, especially for adolescent pregnancies. Now, if you selected letter A, this is incorrect because this is misleading and potentially harmful. Adolescents often have a higher risk of pregnancy complications such as preeclampsia, anemia, and also premature birth compared to adults. And they are going to need more monitoring and support, not less, to ensure both maternal and fetal health. Now, if you selected letter C, this is incorrect because it suggests a reactive approach to healthcare, which can lead to missed opportunities for preventive care. And the prenatal care should be initiated early in pregnancy to monitor fetal growth and also to manage any underlying health conditions, and also to educate the adolescent about nutrition and also lifestyle, regardless whether symptoms are present. Now, if we are just going to wait for the symptoms, then this could delay the necessary interventions as well. Now, for letter D, this is also incorrect because this minimizes the importance of prenatal care, potentially leading to neglect of critical health evaluation and intervention. So we know that the lack of prenatal care is linked to increased risks of complications such as low birth weight, and I'm saying this again, preterm delivery, and even higher infant mortality rates. Let's have number 40. The nurse is conducting a focused assessment on a client with a chest tube. Which action would help the nurse identify signs of subcutaneous emphysema? A. Percussing the area around the chest tube insertion site for abnormal sounds. B. Inspecting the chest tube insertion site for signs of infection. C. Palpating the skin around the chest tube to detect a popping or crackling sensation. And D. Measuring the client's chest circumference to monitor for expansion. The correct answer is letter C, because palpating the skin around the chest tube for popping or crackling sensation helps identify what we call as crepitus. This is the subcutaneous emphysema. If you selected letter A, this is incorrect because percussing is not used to assess for crepitus, but rather to evaluate resonance in the lungs. B is also incorrect because we know that inspection for infection does not reveal crepitus. And D is also incorrect because you know measuring chest circumference is useful for other assessments, but it does not detect crepitus. Let's have number 41. The nurse is educating a client at 37 weeks gestation on signs that require an immediate visit to the labor and delivery unit. Which client statement demonstrates a need for further education? This question has been asked 3 times. A, I should go to the hospital if I feel a sudden gush of fluid from my vagina. B, if I have bright red bleeding, I need to go to the hospital. And C, as soon as I lose my mucus plug, I should go to the hospital. And D, if I notice my baby moving less than usual, I should call or visit the hospital. The answer here is letter C, because losing the mucus plug alone does not necessarily indicate that labor is imminent. It can happen days or even weeks before labor begins. So this option reflects a misconception that requires further education. If you selected letter A, this is incorrect as an answer choice because this answer choice for needing education, because this statement alone indicates a sign of membrane rupture. So when a pregnant person at 37 weeks or later experiences sudden gush of fluid, it indicates that the amniotic fluid has ruptured. So it's signaling the beginning of labor or increasing the risk of infection. So a prompt intervention here is very important to assess labor progression and fetal well-being. If you selected letter B, this is also an incorrect choice. It does not demonstrate a need for further education because bright red bleeding at the stage of pregnancy can signal serious complications, possibly placental abruption or placenta previa, which require immediate medical attention to protect both the mother and the fetus. And for letter D, this is also incorrect. It does not require clarification because decreased fetal movement indicates fetal distress, and this will require immediate evaluation as well in order to monitor the baby's well-being and to ensure that there are no issues with oxygenation or other complications. So again, you're going to have to select that statement that need to be corrected by the nurse, which is letter C. Let's have number 42. The nurse is educating the parents of an infant with tetralogy of Fallot on actions to take at home if their child experiences a hypercyanotic episode. Which instruction is most appropriate? This question has been asked 5 times before. A, place your child in a supine position and provide sips of water. B, hold your child in an upright position and encourage deep breathing. And C, place your child in a knee to chest position and keep them calm. And D, perform chest compressions and call 911 immediately. The answer is letter C, because during a TET spell, positioning the child in a knee to chest position will help increase systemic vascular resistance. It can also improve oxygenation, and keeping the child calm can also reduce the oxygen demand, making this the most appropriate action. And so if you selected either options A and B, these are incorrect because these do not optimize oxygenation. And letter D, this is unnecessary unless the child is in cardiac arrest. Let's have number 43. A nurse is preparing to administer morphine sulfate to an infant experiencing a hypercyanotic episode. Which of the following best describes the rationale for using morphine in this situation? This question has been asked 6 times before. A, morphine acts as a bronchodilator, increasing oxygen intake. B, morphine decreases the oxygen demand by calming the infant and reducing pulmonary artery spasm. C, morphine prevents arrhythmias by stabilizing the heart rate and blood pressure. And letter D, morphine is used to increase cardiac output by enhancing left ventricular contractility. The correct answer is letter B. The sole use of morphine in this case is to help calm the infant, which will reduce oxygen demand, and it will also decrease the infundibular spasm in the right ventricle, which is a key cause of the outflow obstruction in TED skills. Now, this action will allow more blood flow to the lungs for oxygenation. So if you have selected options either A, C, and D, these are incorrect because morphine does not function as a bronchodilator. It does not directly prevent arrhythmias, nor does it increase the cardiac output through contractility. Number 44, the nurse is teaching a client about body's internal clock that regulates sleep and wake cycles. Which of the following hormones is most associated with regulating this biological clock in response to light exposure? This question has been asked 5 times in the past. A, serotonin. B, cortisol. C, melatonin. D, epinephrine. The answer is letter C. We know that melatonin is a hormone produced by the pineal gland in response to darkness, and it's closely associated with regulating the sleep-wake cycle. And this hormone is going to promote sleepiness. It will help align the body's circadian rhythm with the environmental light-dark cycle. So if you selected letter A, this is incorrect because serotonin is involved in mood and well-being. And letter B is more related to the body's stress response. And letter D, epinephrine, is involved in the fight or flight response. Number 45, a registered nurse is assessing a patient with a disturbed sleep-wake cycle due to shift work. Which intervention would best help this patient realign their biological clock? This question's been asked 7 times before. A, taking naps during the day. B, using a consistent sleep schedule. C, taking long sleep breaks on days off. And D, exercising close to bedtime. The answer here should be letter B, maintaining a consistent sleep schedule will help reinforce the body's circadian rhythm, even for shift workers, by stabilizing sleep-wake times. If you select letter A, daytime naps may also disrupt the sleep-wake cycle further. And letter C, long sleep breaks can actually interfere the regular circadian rhythm alignment. And letter D, exercising close to the bedtime may also interfere with sleep onset due to increased arousal and body temperature. Number 46. A nurse observes that a client has difficulty falling asleep and often feels tired in the morning. Which phases of sleep is most likely to be affected if the client reports vivid dreams and muscle paralysis? This question has been asked 7 times in the past. A, non-REM sleep or stage 2. B, non-REM stage 3. C, REM sleep. D, light sleep. The answer is letter C. The rapid eye movement sleep is characterized by vivid dreams and temporary muscle paralysis, which prevents physical movements during dreams. So if REM sleep is disrupted, individuals may feel less rested and may have difficulty with emotional regulation. Whereas the non-REM stages, options A and B, are different in terms of brain and muscle activity. While light sleep, in D, it refers to the earlier stages of the sleep cycle before deep or REM sleep. Number 47. A nurse practitioner is counseling a client with circadian rhythm sleep disorder. Which lifestyle change could best help in resetting the client's biological clock? This question has been asked 3 times in the past. A, avoiding light exposure after waking up. B, eating meals at irregular times. C, using bright light therapy in the morning. And D, limiting social interaction during the day. The correct answer is letter C. Bright light therapy done in the morning can help reset the biological clock by promoting alertness and advancing the circadian rhythm to align with a more conventional schedule. If you selected letter A, avoiding light is incorrect. We know that morning light exposure is very critical for regulating the clock. And letter B, irregular meals and limiting social interaction indeed can disrupt daily rhythms further. 48. A client with a dementia and recurrent episodes of confusion has been admitted to the hospital. The client is exhibiting signs of anxiety and is repeatedly asking, "Where am I?" Which of the following responses by the nurse would best support the client's need for reality orientation and reduce anxiety? This question has been asked 8 times in the past. A, you're in the hospital, but try to remember that you've been here for a few days now. B, let's focus on today. You are here at the hospital and I'm your nurse, Jane. C, you're safe here in the hospital and I'm your nurse, Jane, here to help you. And letter D, why don't we try to recall together? Can you remember where you were before you came here? The best answer here should be letter C. Option C actually is providing clear and simple information about the client's location. It also reassures the client of their safety, and it also introduces the nurse's role, which is essential for grounding and reducing confusion. And so with this kind of approach, it will require the client to recall information they may not remember, thus reducing the risk of increasing their anxiety. Now, if you selected letter C, this is incorrect because asking the client to try to remember might lead to frustration or anxiety if the client cannot recall recent events, and this will exacerbate their confusion all the more. Letter B is incorrect because we know that it can provide the nurse's name. The nurse is providing their name and also general focus on the present, but it lacks the reassurance that the client is in a safe environment, which can be crucial for grounding anxious and confused patients. Now, letter D is also incorrect because asking the client to recall past events places a cognitive demand on the client that may be too challenging, potentially increasing their anxiety and worsening their confusion. If you, let's have number 49. A nurse is caring for a client with advanced dementia who frequently forgets they are in a hospital and attempts to leave. Which of the following interventions best promotes the client's safety while also addressing their disorientation? This question has been asked 5 times in the past. A, gently remind the client each time that they are not allowed to leave. B, position a clock, calendar, and familiar objects from home near the client's bed. And letter C, regularly assess the client's orientation and ask them if they remember why they are hospitalized. And letter D, avoid mentioning the client's location to avoid causing distress or agitation. The answer is letter B, because positioning those familiar items along with a clock and calendar can help reinforce the client's orientation to time and place. And so these visual cues are very supportive without directly challenging the client's memory, which may reduce the need for repeated verbal reminders that can cause frustration. If you selected letter A, this is incorrect because constantly reminding the client of their restrictions without supportive context can lead to agitation and also frustration. And letter C is also incorrect because if you are repeatedly assessing the client's orientation, or if you are frequently asking questions about hospitalization, can also increase the client's confusion or anxiety, especially if they are unable to recall the information. Now, if you select letter D, this is also incorrect because acknowledging the client's surrounding could further disorient them. It can lead to increased anxiety and potential risk to safety as they are going to attempt to leave the unfamiliar environment. Let's have number 50. A nurse is providing discharge instructions to a client who has been prescribed oral acyclovir for shingles. Which statement by the client would indicate the need for further teaching? This question has been asked 5 times before. A, I should drink extra water while taking this medication to protect my kidneys. B, if I forget a dose, I will take it as soon as I remember, unless it's almost time for the next dose. C, I should continue taking this medication until my rash completely disappears. And D, I can take this medication with meals if it causes an upset stomach. The correct answer is letter C. Because acyclovir is typically prescribed for a set duration, often 7 to 10 days for shingles, and does not need to be taken until the rash resolves. So the client here should understand that the medication's purpose is to reduce the duration of the viral symptoms and should be taken as prescribed by the provider, even if the rash remains. If you selected letter A, increasing the fluid intake is essential. As we know, acyclovir is excreted primarily by the kidneys, so this will also reduce the risk of nephrotoxicity. And B is also a correct statement. If a dose is missed, it should be taken as soon as remembered, unless it's close to the next scheduled dose. So doubling up on doses is contraindicated. Now, letter D statement is also a correct statement because we know that acyclovir can be taken with or without food, and taking it with meals may reduce potential gastrointestinal discomfort, which is appropriate for those clients experiencing such side effects. Let's have number 51. A client with a Sinks-Taken Blakemore tube is being transported to radiology for imaging. Which action is most critical for the nurse to ensure safety during transport? This question has been asked 6 times in the past. A, confirm a Yankauer suction device is readily available. B, ensure an emergency trach kit accompanies the client. And C, verify scissors are with the client during transport. And D, position the client on their side for airway protection. The correct answer is letter C. Scissors must accompany the client during the transport in case of airway obstruction, because we know that the tube's balloons may shift. This can cause a blockage in the airway, and we need to make sure that rapid deflation by cutting the tube can save the client's life in such emergencies. Now, if you selected letter A, this is incorrect, because we know that suction can be helpful to clear oral secretions and manage the airway, but it's not the most critical safety measure during transport with a Sinks-Taken Blakemore tube. Again, the highest risk is airway obstruction because of the tube, which cannot be quickly resolved with suction alone. Let's have letter B. This is also incorrect because an emergency tracheostomy kit, we know that it's useful in specific situations, but it's not the most urgent equipment needed during transport. And for letter D, this is also incorrect because although positioning can help with secretions, it will not directly address the critical risk of airway obstruction caused by the balloon in the Sinks-Taken Blakemore tube. Let's have number 52. While monitoring a client with a Sinks-Taken Blakemore tube, the nurse observes a sudden drop in oxygen saturation levels and signs of cyanosis. Which assessment finding would prompt the nurse to act immediately? This question has been asked 8 times in the past. A, the client has a nasal cannula in place, delivering oxygen at 2 liters per minute. B, gastric drainage from the tube appears greenish and bile stained. C, the client's blood pressure has risen to 180 over 90 mmHg. And letter D, the tube has migrated and is causing visible swelling in the neck. The answer here is letter D. Visible neck swelling in a client with a Singstaken Blakemore tube indicates the balloon has migrated or the pressure inside the balloon has caused airway obstruction. And so the nurse must act here immediately to cut the tube with the scissors to release the pressure. And the rest of the other findings, A, B, and D, may require action or maybe adjustments, but these are not critical in the context compared to the immediate risk of airway compromise. 53. A nurse preparing to care for a client with a newly inserted Singstaken Blakemore tube reviews the necessary bedside equipment. Which additional item besides scissors should the nurse prioritize to enhance client safety? A, blood pressure cuff. B, portable oxygen source. C, endotracheal intubation kit. And D, ambu bag and mask. The correct answer is letter D. In addition to the scissors, an ambu bag and also mask should be readily available for airway management if airway obstruction occurs and manual ventilation is required. Letter A is incorrect because although monitoring the blood pressure is essential, it does not directly address the immediate airway risk associated with a Singstaken Blakemore tube. And for letter C, this is also incorrect because we know that having the ambu bag and mask at the bedside is more critical for initial immediate ventilation support. Now, for letter D, letter C, endotracheal intubation kit. I think I've had that one already. And option B, portable oxygen source. This is also incorrect because we know that supplemental oxygen is helpful in managing respiratory issues, but it will not provide ventilation if the client's airway becomes obstructed. Let's have number 54. The nurse is educating a client about strategies to reduce the systemic absorption of prescribed eye drop medication. Which of the following instructions demonstrates the nurse's advanced understanding of minimizing systemic side effects? A, place gentle pressure on the inner corner of the eye for 1 minute after administering each drop. B, close the eye tightly and repeatedly blink to ensure even distribution of the medication. And C, tilt the head back and swallow to encourage proper absorption through the nasopharynx. And D, apply a cold compress over the eye before and after instillation to limit systemic absorption. The answer should be letter A. The application of gentle pressure on the inner canthus is going to help occlude the nasolacrimal duct, which will prevent the medication from draining into the nasopharynx where systemic absorption could occur. If you selected letter B, this is incorrect because this may reduce the local therapeutic effect by forcing the medication out of the eye. If you selected letter C, this is also incorrect because it has no impact on absorption. As we know that eye drops are not absorbed through the GI tract. And letter D is also incorrect. It may constrict the superficial blood vessels, but does not specifically prevent systemic absorption through the nasolacrimal duct. Number 55. A client with a systemic fungal infection is prescribed amphotericin B. The nurse knows that this medication requires close monitoring of which electrolyte due to a common side effect. This question has been asked 7 times before. A, sodium, B, calcium, C, potassium, D, magnesium. The correct answer is letter C, because the amphotericin B can bind to lipid membranes, including those in the renal tubules, and it will lead to formation of the pores, or let's say channels in the membranes, and this can lead to increased permeability. And the pore formation here can also disrupt the normal renal tubular function, especially in the proximal renal tubules where the potassium is normally reabsorbed. And as a result of that, there's going to be massive potassium leakage, and it will lead to the condition hypokalemia. Now, for letter A, this is incorrect. We know that amphotericin B can affect fluid balance and sodium levels indirectly, but sodium is not the primary electrolyte of concern with this medication. Letter B is also incorrect. Calcium imbalances are not a common side effect of amphotericin B. It's generally not associated with the drug, so monitoring calcium is not as crucial for monitoring potassium. Now, for letter D, this is also incorrect. We know that amphotericin B can cause hypomagnesemia in some cases, but it's less frequent and less severe compared to hypokalemia. Let's have number 56. While administering amphotericin B to a client, the nurse prepares for potential adverse reactions. Which of the following should the nurse have readily available to manage infusion-related adverse reactions or side effects? Select all that apply. A, isotonic saline. B, diphenhydramine. C, acyclovir. D, ondansetron. E, hydromorphone. The correct answers are letters A, B, and D. Because the pre-treatment, which includes isotonic saline, diphenhydramine, and also ondansetron, is required to mitigate infusion-related symptoms like fever, chills, nausea, and also rigors. Now, if you selected letter C, acyclovir, this is an antiviral medication, which is not relevant here. And hydromorphone is an opioid analgesic. It's not typically indicated for these specific side effects. We know that the hydromorphone is more suitable in managing pain, but not for the specific infusion reactions. Number 57. The nurse is assessing lab results for a client receiving amphotericin B. Which finding would prompt the nurse to notify the healthcare provider immediately? A, white blood cell count of 8,000 per cubic millimeter. B, hemoglobin of 13 grams per dl. And C, creatinine level of 2.5 milligrams per dl. And D, platelet count of 200,000 per cubic millimeter. This question's been asked 5 times before. The correct answer is letter C. Because the medication is nephrotoxic, this can lead to kidney impairment, and a creatinine level of 2.5 milligrams per dl is elevated, and this may indicate that kidney damage has occurred. We know that the normal creatinine level usually sets between 0.6 to 1.2 milligrams per dl. And so the other values that are shown here are within the normal ranges and would not require immediate notification. Number 58. A client receiving amphotericin B infusion develops a high fever and chills. What is the nurse's priority action? This question's been asked 9 times before. A, stop the infusion and notify the healthcare provider. B, administer acetaminophen and continue monitoring. And C, increase the infusion rate to shorten the duration. And D, apply ice packs to lower the client's temperature. The correct answer is letter B. Fever and chills are common infusion-related side effects of amphotericin B. And so with the administration of the acetaminophen, this is appropriate along with close monitoring. And stopping the infusion is not necessary unless ordered by the provider. And increasing the infusion rate could also intensify the side effects. And ice packs are not recommended in this situation either. Let's have number 59. A nurse is preparing to provide morning care to a client with an internal radiation implant. Which of the following interventions should the nurse prioritize to minimize radiation exposure? This has been asked 6 times in the past. A, spend only 5 minutes in the client's room at a time, delegating the rest of the care to assistive staff. B, maintain at least 3 feet of distance when direct contact with the client is not required. C, place the client in a room at the end of the hallway to minimize exposure to other clients. And D, ensure all care is provided through a lead-shielded window to avoid entering the room. The answer should be letter B. The nurse should prioritize maintaining as much distance as possible and from the client without compromising the care. And this actually will reduce the radiation exposure significantly. If you selected letter A, this is incorrect because we know assistive staff should not be overexposed. And letter C is also incorrect as the client should have a private room, not necessarily at the end of the hallway. And letter D, this is also impractical as the nurse must enter the room to provide the care. Number 60. Which of the following statements indicates the need for further education in the nurse assigned to care for a client with an internal radiation implant? This question has been asked 8 times. A, I will leave any soiled linens in the room's linen bin for proper disposal. B, I should avoid prolonged time with close proximity to the client when not providing direct care. And C, the client should be in a private room with restricted access to minimize radiation exposure to others. And D, I should avoid wearing personal protective equipment if I'm not handling bodily fluids. The answer here is letter D. Nurses should always wear personal protective equipment, particularly lead apron when entering the room of a client with a radiation implant, regardless of whether bodily fluids are involved. If you selected letters A, B, and C, these reflect appropriate care and also precautions for minimizing radiation exposure to others. Let's have number 61. A nurse is reviewing the safety protocols for caring for clients with internal radiation implants. Which of the following practices demonstrates appropriate radiation safety? This question has been asked 8 times before. A, grouping nursing tasks to minimize frequency of room entries. B, limiting staff access by restricting entry to only unlicensed assisted personnel. And C, scheduling frequent but brief visits to the client to closely monitor their condition. And letter D, disposing of soiled linens immediately outside the client's room to maintain cleanliness. The answer is letter A. Grouping tasks can reduce the time and also frequency of exposure, which will minimize radiation risk. Now, if you selected letter B, this is incorrect, as we know that only trained personnel, not solely unlicensed personnel, should enter the room. Now, letter C increases the frequency of exposure unnecessarily. So this is incorrect. And letter D is also incorrect because soiled linens should remain in the room to prevent accidental exposure to others. Let's have number 62. During orientation, a new nurse asks about precautions when caring for a client with a radiation implant. Which response by the preceptor indicates an accurate understanding of radiation safety? This question has been asked 6 times before. A, you should stay as close to the client as possible to reduce exposure to others. B, wear a lead apron when you enter the room, especially during procedures requiring direct contact. And C, after handling bodily fluids, dispose of all materials immediately outside the client's room. And D, the client should be placed in a shared room with another radiation client to isolate exposure. The answer is letter B. Wearing a lead apron is required to reduce the radiation exposure when the nurse is in close contact with a client. Options A and D are incorrect because staying close increases exposure, and a private room is required to prevent radiating other clients. Also, letter C is incorrect, as all potentially contaminated items should remain in the client's room to avoid spreading contamination. 63. A nurse is caring for a client with a radiation implant who has requested a room transfer. Which action should the nurse take to address the client's request while ensuring radiation safety protocols are upheld? This question has been asked 9 times. A, move the client to a shared room with a fellow radiation client to maintain isolation. B, offer the client an isolated private room with a private bathroom to limit exposure risks. And C, suggest moving the client closer to the nurse's station for frequent observation. And D, advise the client that no transfers are allowed due to radiation safety protocols. The answer is letter B. Clients with the radiation implants must be in a private room with a private bathroom to protect others from the radiation exposure. Now, if you selected letter A, this is incorrect because clients with the radiation implants should not share rooms, even with other radiation patients. And the goal here is to minimize radiation exposure to others, and also sharing a room increases the risk of exposure to fellow patients and healthcare staff. Now, take note that radiation safety protocols require that the client be isolated in a private room with a private bathroom to ensure safety and limit radiation exposure. If you selected letter C, this is also incorrect because moving the patient closer to the nurse's station could increase the exposure risk to staff and other patients. And we know that radiation implants can emit radiation. So healthcare personnel need to be protected from unnecessary exposure as well. Now, again, minimizing exposure is a priority. So placing the client close to the nurse's station would contradict radiation safety protocols. If you selected letter D, this is also incorrect. We know that client safety and radiation protocols must be maintained. The response that no transfers are allowed might be too restrictive. So it's really important to consider safe options that accommodate the client's request without compromising safety. So offering a private room with a private bathroom is a much safer solution that respects both the patient's request and also the radiation safety protocol. So a flat no transfers response without exploring other alternatives might not fully meet the client's needs and could be seen as being dismissive. Number 64. The nurse instructs a caregiver on the potential side effects of enoxaparin. Which statement made by the caregiver indicates a correct understanding? This question has been asked 4 times. A, if I notice any swelling in the client's legs, I will stop the medication immediately. B, if the client has a mild headache, I can give them aspirin to relieve the pain. And C, I should watch for signs of bleeding, such as nosebleeds or blood in the urine. And D, I should massage the injection site to promote faster absorption of the medication? The answer here is letter C, because the statement shows correct understanding, and the caregiver should monitor the patient for signs of bleeding, as enoxaparin increases bleeding risk. If you selected either A and B, require further clarification, as swelling could indicate a serious side effect, maybe heparin-induced thrombocytopenia, which should prompt immediate medical attention, but not discontinuation without consulting a provider. Okay. Now, if you selected letter D, it's also incorrect. Massaging the site could increase bruising or bleeding. Number 65. A nurse is explaining dietary considerations for a client on enoxaparin. Which of the following caregiver responses would require additional education? This question has been asked 8 times before. A, I understand that I don't need to adjust their intake of green leafy vegetables. B, I should monitor the client's intake of foods high in vitamin K, like spinach. C, this medication works differently than warfarin, so no specific foods need to be avoided. And letter D, I'll continue to provide a balanced diet without worrying about vitamin K interactions. The correct answer is letter B. This statement requires further education because, unlike warfarin, enoxaparin does not interact with vitamin K, so there is no need for the caregiver to monitor foods high in vitamin K. If you selected letter A, this is actually a correct statement, right? What we were looking for in this question is the incorrect statement that requires education. And so letter A is a correct statement because we know that enoxaparin is a low molecular weight heparin that does not interact with vitamin K. If you selected letter C, this is also incorrect because, again, it works through a different mechanism than warfarin. It does not require dietary restrictions related to vitamin K. If you select letter D, this is also incorrect. We know that enoxaparin does not interact with vitamin K, and the caregiver here is right in stating that they can continue providing a balanced diet without worrying about vitamin K interactions. So there's no special dietary adjustments necessary for enoxaparin. 66. Which instructions should the nurse include when teaching a caregiver about precautions while a client is on enoxaparin therapy? A, make sure the client uses an electric razor instead of a regular one to reduce bleeding risk. B, if the client has any pain, avoid giving them any medication until consulting a nurse. And C, regular blood work will be necessary to monitor the client's platelet count. And D, if a client has a history of peptic ulcer disease, they should double their dose. This question has been asked 7 times before. The correct answer is letter A. This statement is correct because using an electric razor will minimize the risk of cuts and also bleeding. Now, if you selected letter B, this statement requires further clarification because safe pain relief options should be considered. So, patient here should be avoiding NSAIDs this time. Letter C is incorrect because this statement is accurate for monitoring HIT risk. And letter D, if the client has a history of peptic ulcer disease, they should double their dose. This is also an incorrect option because clients with a history of peptic ulcer disease may need to avoid enoxaparin. And there's going to be a need also to adjust their dosing schedule. That can be done by the medical provider. 67. The nurse in the emergency department is assessing a 1-month-old infant who is unresponsive and suspected of cardiac arrest. Which pulse site is the most appropriate for the nurse to palpate to quickly assess the infant's circulatory status? Has been asked 8 times in the past. Very common question. A, brachial, B, femoral, C, radial, and D, carotid. The answer is letter A. Brachial artery, which is located inside the upper arm between the infant's elbow and shoulder, is the best site to palpate in an infant during a suspected cardiac arrest. It will provide a quick and accessible feedback on circulatory status. If you selected letter B, femoral, it is accessible, but it's not typically used for assessing cardiac arrest in infants. For letter C, radial, it's not suitable for infants due to the weak pulse strength of the site in young infants. And letter D, carotid, is the correct pulse site for adults in cardiac arrest, but it's not recommended for infants because it's very challenging to palpate accurately in this age group. Number 68. In preparing to perform chest compressions on a 1-month-old infant in cardiac arrest, the nurse correctly positions their hands. Which of the following describes the correct technique? This question has been asked 5 times before. A, place 2 fingers in the center of the chest and compress about 2 inches at a rate of 100 to 120 per minute. B, position both thumbs side by side on the center of the chest below the nipple line and compress about 1.5 inches. And letter C, use the heel of one hand on the center of the chest and compress 1 inch at a rate of 80 to 100 per minute. And letter D, position the palms on both sides of the infant's chest and apply general compressions at a rate of 60 to 80 per minute. The correct answer is letter B, because for infants, the recommended compression technique involves placing both thumbs side by side on the center of the chest, just below the nipple line, with the compression approximately 1.5 inches deep at a rate of 100 to 120 per minute. And so letter A is incorrect because compressing 2 inches may be too deep for this 1-month-old infant, which can lead to injury. Now, additionally, in that statement, although the rate of 100 to 120 compressions per minute is correct, the depth is too much in this case. If you selected letter C, this is also incorrect because the technique described here is not suitable for infants. So the heel of one hand is typically used for adult or, let's say, a larger child resuscitation. But for an infant, the correct method is to use both thumbs side by side on the chest. Now, the compression depth should be 1.5 inches, and the rate should be 100 to 120 compressions per minute, not 80 to 100 per minute. Letter B is also incorrect because that technique described here uses the palms in both hands of the chest, which is not recommended method for infants. Again, the correct method involves placing both thumbs side by side on the center of the chest, just below the nipple line. And make sure that the compression rate is also observed. That should be 100 to 120 compressions per minute, not 60 to 80 per minute. Number 69. When assessing the need for CPR in a 1-month-old infant, the nurse should focus on which key indicators before initiating compressions. This question has been asked 10 times before. A, check for responsiveness, call for help, and check the brachial pulse. B, assess the breathing rate, check the carotid pulse, begin rescue breaths. And C, check for pallor, palpate the femoral pulse, and apply oxygen mask. And D, measure heart rate with a stethoscope, evaluate reflexes, and begin chest compressions if unresponsive. The answer is letter A, because in infants, checking for responsiveness, calling for help, and also palpating the brachial pulse are critical first steps to assess if CPR is needed. And the breathing and pulse checks should be quick, within 10 seconds, to determine the need for immediate resuscitative efforts if the infant is unresponsive and has no pulse. Now, B is incorrect. Although it's important to check if the infant is breathing, but the main focus in assessing CPR readiness for infants is responsiveness and pulse. So if the infant is not breathing or only gasping, it would indicate the need for rescue breaths. But this step comes after checking responsiveness and pulse. Now, check the carotid pulse. The carotid pulse is not the primary site for infants. You should be checking the carotid pulse. So that's why this option is incorrect. Now, for letter C, check for pallor. While we know that pallor or paleness could be a sign of distress, but it's not a reliable primary indicator for the CPR. Okay, the key focus here should be responsiveness, pulse, and breathing. And what makes this statement wrong also is that with the use of the femoral pulse, this is very difficult to assess quickly in infants, and the brachial pulse should be checked instead. Now, the application of oxygen mask in the context of CPR, the priority here is to assess responsiveness and pulse, not immediately applying an oxygen mask, because we need to manage their airway first. Okay. After the chest compressions are initiated. Let's have letter D, the last option. This is also incorrect. The stethoscope is not recommended to be used in checking the pulse. We need to use the brachial pulse instead, and evaluating reflexes are not necessary to assess for CPR. The focus here should be on whether the infant is responsive if there is a pulse. Now, begin chest compressions if unresponsive. The chest compressions are started if there is no pulse. The first step, however, is to check for responsiveness. Then the brachial pulse and the compressions are initiated if the pulse is absent or if it's too slow. Number 70. After an esophagogastroduodenoscopy or EGD for gastroesophageal reflux disease, the nurse is preparing for discharge a client. Which of the following statements indicates the client understands the discharge instructions? A, I should avoid eating for at least 1 day following the procedure. And B, it's okay to lie down after eating. It doesn't matter. C, the contents of my stomach won't harm my esophagus, but they may make me feel sick. And D, I should stay away from orange juice and tomatoes until my esophagus has fully healed. The answer is letter D, because avoiding acidic foods such as these beverages is important to allow the esophagus time to heal. Letter A is incorrect because clients can resume eating once their gag reflex has returned, so waiting an entire day isn't necessary. And B, after meals, clients with GERD should remain upright for 2 to 3 hours to reduce the risk of reflux. And letter C, stomach contents are acidic and can irritate the esophagus. Let's have number 71. During a discharge teaching session with the parents of a newborn with hyperbilirubinemia, the nurse emphasizes monitoring for early signs of kernicterus. Which of the following instructions should the nurse give regarding these early signs? This question has been asked 3 times. A, look for signs of jaundice spreading from the chest to the abdomen. B, monitor for periods of poor feeding and increased sleepiness. And C, watch for episodes of rapid breathing and sweating. And D, observed for signs of high-pitched crying and muscle twitching? The answer is letter B. Poor feeding and lethargy are early neurological signs of kernicterus, which is a severe complication of hyperbilirubinemia. So if you're recognizing these symptoms, these are actually indicating that the bilirubin is crossing the blood-brain barrier. So this will require immediate medical attention. So the other options here, letters A, C, and D are incorrect because in A, the spread of jaundice from the chest to the abdomen is a sign of increasing bilirubin levels in the bloodstream, but it's not an early sign of kernicterus. We know that jaundice in the skin is common in newborns with hyperbilirubinemia, but it primarily indicates the need for monitoring bilirubin levels and treatments such as phototherapy. And this one is not specific to kernicterus, which is a neurological complication. Now, if you select the letter C, this is also incorrect. We know that breathing irregularities can occur in newborns with severe hyperbilirubinemia, but these are not typically associated with early stages of kernicterus. The early signs of kernicterus are primarily neurological, like poor feeding, lethargy. And also letter D, it's also incorrect. High-pitched crying and muscle twitching are late signs of kernicterus, not early ones. All right. Let's have number 72. A nurse is caring for a newborn under phototherapy for hyperbilirubinemia should prioritize which of the following actions to monitor for potential complications. This question has been asked 10 times before. A, assess the newborn's skin color for any changes in jaundice severity, and B, monitor for increased irritability and frequent crying, and C, measure bilirubin levels once every 24 hours, and D, document daily weights and assess for dehydration signs. The answer is letter D. Phototherapy can lead to fluid loss through increased insensible water loss, which will make dehydration more prominent. Now, if you selected letter A, this is incorrect because we know that skin color and jaundice severity is important, but it doesn't take priority over monitoring for dehydration during phototherapy. And letter B is also incorrect because increased irritability and crying could indicate discomfort or other issues, but they are not specific indicators of phototherapy complication. And same thing with letter C, this is incorrect. We know that bilirubin levels should be monitored more frequently than every 24 hours in newborns receiving phototherapy, especially in cases of hyperbilirubinemia. So the assessment should be at least every 12 hours, okay, in cases of critical cases. Let's have number 73. The nurse is caring for a legally blind client who has just been admitted to the medical surgical unit. Which nursing intervention would most effectively promote the client's sense of independence? This question has been asked 5 times before. A, arrange for the client's meals to be delivered at scheduled times. B, describe the room layout and demonstrate the use of the call light system. And C, place tactile markers on essential objects around the room. And D, instruct the client to call for assistance when attempting to move. The answer should be letter B. When you're describing the room layout and also demonstrating the call light system, is very essential to orient this client. And this will help also for this client to become much more familiar with their environment, and also it can promote some independence. And so the other options, letters A, C, and D, these are all incorrect because for A, arranging for meals to be delivered at specific times is somewhat a passive approach. It does not encourage the client to interact with their environment or make decisions on their own. And we know that independence in a hospital setting for a legally blind client involves giving them the tools and also the knowledge to manage their day-to-day tasks, such as knowing when meals are ready and how to reach them. Now, letter C is also incorrect because tactile markers can be useful for a legally blind client, particularly in the long-term management of their environment. However, they should not be the first step in promoting independence. Let's have letter D. This is also incorrect. We know that this is important to ensure that the client has the ability to call for help if needed, but this intervention does not promote independence. Instead, it may encourage dependence on others to navigate their environment. So that's also incorrect. Let's have number 74. A nurse is preparing to meet a newly admitted client with legal blindness. Which approach should the nurse prioritize to establish rapport and reduce anxiety? This question has been asked 6 times before. A, speak to the client in a louder tone to ensure they can hear clearly. B, address the client by name and identify themselves upon entering the room. And letter C, begin by asking the client detailed questions about their vision impairment. And D, immediately guide the client around the room to familiarize them with the environment. The answer is letter B. When you're addressing the client by name and also introducing themselves, it's very critical to build rapport. It will establish trust, and also it can reduce anxiety. So this will help the client feel much more secure in knowing who is speaking. However, speaking louder is not necessary unless there's a hearing issue. And also the familiarization of the environment should follow a calm introduction, and asking about impairment details immediately may also cause unnecessary stress to this client. Let's have number 75. A nurse is assessing a client diagnosed with bulimia nervosa who reports feeling extremely weak and tired. Which finding requires the nurse's immediate intervention? This question has been asked 9 times. A, reports of recent episodes of vomiting. B, complaints of painful throat irritation. And C, a statement expressing feelings of hopelessness. And D, complaints of frequent muscle cramping. The correct answer is letter D. This one requires immediate follow-up because the muscle cramping indicates electrolyte imbalance, specifically hypokalemia, which is very common in clients with bulimia nervosa due to their frequent vomiting or laxative use. And this can lead to life-threatening cardiac dysrhythmias if left unaddressed. So this will take priority. If you selected letter A, B, or C, these are all incorrect. We know that A, we know that this is important to acknowledge and address, but it's not as immediately life-threatening as the physiological consequence of hypokalemia. And letter B is also incorrect. Throat irritation can be due to the effects of vomiting, but does not indicate an immediate crisis. And for letter C, expression of hopelessness, while we know that this is critical for mental health assessment, but it does not pose an immediate physiological threat in this context. Take note about the manifestations: extremely weak and tired. We've got to deal with that hypokalemia. That is a high priority. Then followed by that concern of hopelessness. This is the end of our Q&A this time. So great job if you've lasted throughout the 75 questions. And we know that focusing on these key topics and also the reasoning patterns, you're now better prepared for the NCLEX. Remember that with consistent practice and review, this will continue to build your confidence and also sharpen your skills. So I want you to stay focused, keep reviewing, and trust in your preparation as you move forward. Thank you, and you have a great day. Bye, everyone.